Okay.
So today, before we start the exam, I'm going to show you the range of motion. So first we'll do the fingers. This is flexion, extension, abduction, adduction. Then we'll have the wrist, which is flexion, extension, radial deviation, ulnar deviation. Then for the elbow, we have flexion, extension, supination, pronation, and then the rotator cuff, we have flexion, and then extension, circumduction, abduction, adduction. Then we have internal rotation and external rotation. For the neck, we have flexion, extension, left rotation, right rotation, left lateral bend, right lateral bend. Then we'll do the spine, which is flexion, extension, left rotation, right rotation, left lateral bend, right lateral bend. We have the hip, this would be flexion and extension. Then we have abduction, adduction. You have internal rotation, external rotation. And then have the knee, which is flexion and extension. And then the ankle, which would be plantar flexion, dorsiflexion. Then you have inversion and eversion. Then the toes, you have flexion and extension. So now, the first thing we want to do on these exams, we would always want to compare bilaterally. If you have an injured area, you want to assess that side first, and then, the uninjured area first, and then assess the injured area and compare. But for time's sake today, we're only going to assess one side. So for the first exam, we're going to assess the stability of her knee. So we're going to do the valgus test, and that checks the medial aspect of the MCL. So for the valgus test, we're going to push medially on the knee, we're going to pull laterally on the ankle, and we're going to feel the knee joint to see if there's any gap. Do you have any pain? So that would be a negative valgus test. The vargus test checks the lateral, the LCL, so we're going to be pushing laterally on the knee. We're going to feel the lateral knee joint while pushing medially on the ankle. Did you have any pain? No. And there was no gap felt in the lateral knee, the lateral joint line. So now we're going to move to the anterior and posterior drawer test. The anterior drawer test checks for the ACL, and you're going to be looking for an anterior shift of the femur, of the tibia from under the femur that would look like a drawer opening. Then we'll also look at the posterior drawer test, which would be a posterior shift in the tibia. So I want to stabilize the foot. And then I'm going to do the anterior. And there was no shift, so that would be a negative anterior drawer test. Then I'm going to pull. I did it right backwards. The anterior drawer test would be pulling out, and there's no shift, so then we'll do the posterior drawer test, which checks the PCL, and there was no shift there. So both the anterior and posterior drawer tests were negative. So now we'll do the McMurray sign. The McMurray sign would be checking the meniscus. So we want to have you bend your leg up again, and I'm going to be feeling for and listening for any clicks or pops. So for the medial meniscus, we're going to push inward, and we're going to rotate the foot out, and then we're going to lower the leg down. There were no clicks or pops, and for the lateral aspect, we're going to pull laterally on the leg and push, turn the foot inward, and we're going to lay down. There were no clicks or pops felt. So that would be a negative McMurray sign. So the next test we want to do is for carpal tunnel syndrome. So if you will, please stand up. You can just have a seat. So let your hand just relax. And so we're going to tap the medial nerve here. And there's two tests. The tensile test was the first one. And we would expect on either one of these tests for you to have numbness, tingling, or pain in the second, third, and fourth finger if you have a nerve impingement. So I'm going to tap on the medial nerve. Did you have any pain, numbness, or tingling? No. So that would be a negative tensiling test. And then if you will, place the backs of your hands together and press. We would have a press for 60 seconds, and we would assess for, again, pain, numbness, or tingling at that time. And did you have any? So that was a Phalen's exam, and that would be a negative Phalen's exam. So the next test we want to do is for the rotator cuff. So if you will, stand up. So I'm going to look at your back first. I just want to palpate the muscles. I want to make sure that there's no tenderness felt and no muscle spasms. So this is the supraspinatus, the infraspinatus, the teres minor, and the suprascapularis. Do you have any pain?
No.
Okay, so no pain was felt. So that would be a normal finding. So now we want to assess the strength of these muscles. So if you will turn and look at me. So for the first test, we're going to assess the supraspinatus. So we'll do the empty can test. So if you will, put your hands out in front of you with your thumbs down. Thumbs down. And I'm going to try to push down on your hands, and you try to hold them there. So her strength was equal bilaterally, and she didn't have any problem with that, so that would be a normal exam. Then we're going to check the drop arm test, and that also checks the supraspinatus muscles. So if you will, raise your arm up, and then slowly lower them down. And she didn't have any weakness, and did you have any pain during that exam? So there was no weakness that I saw bilaterally, so that's a negative exam. The next test we're going to do is going to check the infraspinatus muscle, and it's going to be the external rotation. So if you will, I'll have you bend your elbow and then push against my hands. Okay, so she had strength, good strength in that one. We would do this side and compare. I'm sorry. Now, we would do this side and compare, and the strength was equal, so that would be a normal exam. The next thing we're going to do is for the suprascapularis. So if you will, bend your arm at a 90-degree angle behind you. We're going to slightly pull the arm away from her back, and we're going to try not to let me move your arm. And there was no movement in the arm, so that is a normal exam. We would, of course, do this bilaterally on both sides. So the next thing we want to do is range of motion. So if you will, we're just going to do flexion, which raise your arm up. And then we're going to do extension all the way back down. And then we will do circumduction, round in a circle. And then we would do the abduction, and then adduction, means your arm at a 90-degree angle. There you go. And then we want to make sure that she has good rotator cuff motion, so I'll have you to put your arm behind your back here and touch your shoulder. Okay, and then come back around the other way. And this is the Appling scratch test, and she does have good movement in the rotator cuff. So the Appling scratch test would be normal. The next thing that we want to do is have the patient have a seat on the bed, and I'm going to assess the paravertebral muscles in her back. So we'll do these, and what we're feeling for is any muscle spasms, and tell me if you have any pain. Do you have any pain? Okay, so that was normal. I'm going to assess over the vertebrae to make sure that she has no pain here. Pain over a bony prominence might be an indication of a bone fracture, and she doesn't have any. So now we're going to ask you to stand back up again, and we'll do range of motion. So if you will lean forward, all right, and then lean back, and then turn to your left without moving your hips, turn to your right without moving your hips. Now lean to your left without moving the hips, and to the right. So she had good range of motion, and that was adequate, so that would be a normal finding. Now I want to do the straight leg raise, so if you'll lay down. So what I'm going to get her to do is to just raise her leg up, and what we're looking for is, there's two different types of pain you can have. One is going to be muscle pain, and that's going to be just a nagging pain, but a nerve pain would be like a shooting pain that comes from your lower back into your buttocks and into your thigh, okay? So we're looking for nerve pain. So lift your leg up. Did you have any nerve pain? No. If she did have nerve pain, we want to note at what angle, and then we want to do the cross straight leg test, so we'll do the other side. And did you have any pain? No, and that might be an indication of an impingement of the sciatic nerve. So now we'll go back and we're going to check for scoliosis. So if you'll stand back up for me one more time. So I want to check the shoulders to make sure that they're level. And then I will check the iliac crest to make sure they're level. And then we would need her to take her shirt off. And if you will bend over, I'm just going to check the spine here. And I'm looking for, she would need to bend at a 90-degree angle. And I'm going to check the spine for any left or right deviation, anterior or posterior curvature. And I want to look at the entire back to make sure that it's symmetrical, and it is. So you can stand back up. Now we're going to check for some winging. So to check for winging, I have you put your arm out in front of you and then push against my hand. And we're going to feel the scapula to make sure that there's no winging here. And there's not. Sometimes in people who are extremely skinny that they might be some winging, but that would be a normal finding for them. Okay, so during the back exam, we would normally do deep tendon reflexes, but we're going to go ahead and do that during the neuro assessment now. So you'll have a seat. So for the neuro assessment, we're going to be rating the deep tendon reflexes 0 to 4. 0 being absent, 1 being slightly diminished, 2 being normal, 3 being hyperactive, and brisk, and 4 being very brisk, hyperactive with clonus. So first we'll do the brachial and the supinator, and so those are controlled by C5 and 6. We'll do the tricep, we're going to do the bicep and the supinator, and those are controlled by C5 and 6. Then we'll do the tricep, which is controlled by C6 and 7. We'll do the knee, which is controlled by L1, 2, 3, and 4, and the ankle, which is controlled by S1. So for the first test, we're just going to find the bicep tendon. So there you go. All right, and just let your hand lay flat. And this is the only one that we'll check by striking our finger as opposed to actually striking the tendon. So what you would normally find here would be a contracture of the bicep, and you would see a flexion of the elbow, and you would want to assess those bilaterally and give them a grade of 0 to 4. The supinator would be here, and we would strike, and what we would normally see would be flexion of the hand, and you would rate that 0 to 4. The tricep, we'll check back here, and so you would see a contracture of the tricep, and you would see extension of the elbow. For the knees, you want to make sure that the feet are not touching the floor. And when you strike it, you want to make sure that there is a contracture of the quadricep and the foot is outward movement of the foot. Sometimes you can't see the quadricep muscle move, so you can feel with your opposite hand. And you would expect contraction here, and then movement of the foot. And you would rate that 0 to 4. For the ankle, we would slightly dorsiflex the foot. We would strike the Achilles tendon, and you would expect downward motion of the foot, the plantar flexion. So, now we're going to check for some meningeal signs. So meningitis. So if you will lay down. Meningeal signs and meningitis. So first thing we're going to do is we're going to do the Brudzinski sign. So if you will touch your knee to your chest. Okay, and what we're looking for here is any motion in the hips or knees. That would be indicative of a possible meningitis. And there was no movement, so the Brudzinski's was negative. The Brudzinski sign, we'll take the handle of the hammer, and we're going to move up the lateral aspect of the foot across the ball and watch for any movement. A positive Brudzinski sign would be fanning of the toes or dorsiflexion, but there was not any. Normal would be either no movement or possible curling of the toes or plantar flexion. So the next test we want to do is a kerning sign. So I'm going to just have you lift your leg up. Do you have any pain? So we would do that bilaterally, but this is not a very good indicator of meningitis, as it could be affected by lower back nerve impingements. So the next test we're going to do is going to be for coordination. So if you will, stand up. So we're going to be looking at coordination with her walking. And the main things we're going to be looking at is at the base of her feet. We're going to be looking at her heels. They should be 4 to 5 inches apart. You're going to look for a smooth, rhythmic motion when she walks with opposite hand and opposite leg movement. So if you will, just walk out this way. Okay, and if you'll walk heel to toe back, please. Okay, and if you'll walk on your tiptoes and on your heels. So that was all normal, and she was able to do that, maintain her balance. Gait was normal, and everything appeared to be normal. So the next thing we want to do are some rapid alternation movement tests. So if you'll have a seat on the bed. So the first thing we want to do is lay your hands in your lap, and you want to turn them over and put your palms on your lap, and you want to alternate. Okay, close your eyes. She's able to maintain coordination. That's normal, so you can stop now. The next test we want to do is the fingers to thumb test. So you'll do this way. Okay, faster, and then close your eyes. And she was able to do that very well. You can stop now. So the next test we want to do is the ball of the foot to the hand. So what you're going to do is just tap the ball of your foot onto my hand, and then back to the floor. Very good. She does that very coordinated, so that's not a problem at all. You would, of course, do all of these exams bilaterally. The next exam we want to do is for a point-to-point test. So we're going to have you stick your arms straight out and then alternate touching your nose. And do that a little faster with your eyes closed. Okay, you can stop now. So now I want you to touch my finger and then touch your nose. And as your finger's going back to your nose, I'm going to move my finger, okay? Of course, we would do this bilaterally, and she would do that adequately. The next test we want to do is, so you have you lay down, And we're going to have you put your heel, this heel, over onto this leg and slide it down. And opposite. So she was able to maintain contact with the skin and had good coordination when doing that. Okay, so you can stop that. And the next test we're going to do is going to be a sensory test. So if you will, I'll have you sit up. I'm sorry, we're going to go back to the coordination test. So for the coordination test, we also want to do the Romberg test. So if you'll stand up, and with your hands straight out in front of you, we're going to have you close your eyes, and for 60 seconds we're going to watch. If she has a slight sway, that would be a normal finding. If she has a sway or loses her balance, that would be abnormal finding. So for sake of time, we're going to assume it's been 60 seconds, so you can put your arms down. Now this time we're going to put your arms back up with the palms up, and we're going to watch her for 60 seconds to see if there's a pronator drift. The pronator drift would be positive if her hands were to turn inward at all. So we'd watch it for 60 seconds, and then I'm going to push your hands down and you place them back into place. So there was no rotation, so that's a negative pronator drift. So now we're going to move on to the sensory. The sensory exam, we're going to do 2 tests, and it's pain and light touch. So if you'll have a seat on the bed. So you can push your sleeves up for me. So the first exam, I want you to close your eyes, and I'm going to tell you which one that I'm doing, and then you'll tell me each time I touch you if it's light, if it's pain or light touch. That's going to be pain, and this would be light touch. Okay?
Light touch. Light touch. Pain. Light touch. Pain. Pain. Light touch. Pain. Light touch.
Okay. Now I'm going to do your feet. Just keep your eyes closed.
Light touch. Pain. Light touch. Pain. Pain. Light touch. Pain. Light touch.
Okay, so that was all normal. So the next test we want to do would be we'll check to see if she can feel the vibrations of this, and what we want to check would be if she feels the vibrations, and then if we think that maybe she's feeling the actual touch and not the vibrations, we'd ask her to tell us when the vibrations stop. So we would strike it. Close your eyes for me. Tell me when you feel me.
Now. Now. Now.
Okay, tell me when you feel it stop.
Now.
Okay. Right, so she was able to do all that. That was all normal. So the next test we're going to check for is stereognosis. So if you will, hold your hand out and keep your eyes closed. I'm going to place something in your hand, and you tell me if you are able to identify it.
A key.
Okay. And then, so the next test we're going to do is going to be graphesthenia, and so I'm going to draw a number in your hand, and with your eyes closed, you tell me what the number is.
3.
Okay. And we, of course, would do that bilaterally. So that is the end of the test.